January is Cervical Cancer Awareness Month. More than 14,000 women in the United States are diagnosed with cervical cancer each year. And we have our medical expert, Dr. Payal Kohli, to talk to us today. Also, we're going to talk about why men care about this. This is why Tom's part of this conversation.
I'm here. Yeah.
Cervical cancer is one of the few cancers that it feels like we don't hear enough about, and it's also caused by an infection.
Yes, an interesting cancer, because a lot of cancers aren't necessarily caused by a virus, but in this case, almost all cervical cancers are caused by a virus called HPV, or human papillomavirus, and it's a really common virus. If you're sexually active, chances are you have had HPV or will get it if you haven't been vaccinated. And there's different types of HPV, so there's bad ones, high-risk ones that can cause cancer, but there's also kind of more low-risk ones that cause conditions like warts.
Well, I wanted to ask you about it because we talk about cancers as sometimes the luck of the draw, but this is a cancer that's preventable. This is a cancer that people can avoid. So you talked about who's at most risk here, but people could get in front of this.
Highly preventable, and that's the message here, that this is one of those cancers that we can almost nearly eradicate. And to Kim's point earlier, men should care about it too, because it's not just cervical cancer that's caused by HPV, but we can also get anal cancer, penile cancer, vulvar cancer, oral cancer, all caused by this virus. So getting our kids vaccinated, getting ourselves vaccinated, if we haven't been sexually active or exposed, is really important. And we're talking kids the age of 11 or 12. So it's never too early to start talking about sex really before they're active and get them vaccinated and protected.
I remember the pediatrician saying to me, like, okay, Tanner's 12 years old. It's time to get that. And I was like, oh, gosh, okay. It's something you're kind of surprised by, but it makes perfect sense.
Yes, and for the young men as well, because you want to remind them that even though they don't have a cervix, because that's, part of the uterus, but they can certainly spread HPV, and then of course they can be at risk themselves for the conditions we discussed.
So how are we doing in this fight? Because obviously we do have vaccines. We are capable of preventing it. Are we winning the war against cervical cancer?
We're not. In fact, recent data tells us that pediatricians, in fact, even the way that they present it to the parents can sometimes be a little off-putting. And a lot of parents can feel there's some stigma associated with this because it's a virus that's transmitted through sexual contact. But we really need to do better. We need to start having that conversation with our kids and start normalizing it in schools and doctors' offices. And then the ones that are particularly high risk, the individuals who may have a compromised immune system, individuals who smoke, individuals who started being sexually active early, even actually people who take birth control pills are higher risk for cervical cancer.
Wow, I didn't even know that. This is also a cancer that I've read, like the symptoms don't typically show up that early, which makes it all the more dangerous.
Yeah, so the cancer can be cured if it's diagnosed early, but the only way to diagnose it early is to go looking for it, because that virus kind of sits inside the cervical cells. It takes many, many years to mutate those cervical cells, and you really won't start having symptoms like bleeding, or pelvic pain until the cancer is advanced and it spreads. So those pap smears are the way that we really diagnose these, and we have to start those early at the age of 21, and really do them regularly as well.
You talk about the cultural issues and some of the social issues that come with people not getting vaccinated for it. How do you work around that if you're a parent, or how do you work around that if you're a youngster?
I think the COVID-19 pandemic has really sort of hopefully empowered us to believe and trust in the power of vaccination, to normalize the conversations around prevention, and maybe we can tell our youngsters that if they're vaccinated, they're actually protected. It would mean less procedures, less risk for obviously cervical cancer. And for young women, if we start developing cervical changes early, it can affect our fertility, our ability to carry a child. Those are all really important outcomes when it comes to a young teenage girl. So talking to her about it and sort of just helping her understand the condition, I think, can really improve the rates of vaccinations.
So parents,
that's a good way to put that.
If you have tweens or teens, do your research. And tweens or teens, if you're listening to, do your own research. Learn more about it.
Absolutely. And talk about it with your friends, because it's important that you encourage them to do it too.
Yeah. Sometimes when you're a really young age, you never think these things apply to you.
Right.
But boy, every year, a lot of things apply to you.
That's right.
Comes and gets you.
Yeah.
Dr. Kohli, thanks as always.
Thank
Good to
you.
see you.